Welcome, everybody. My name is Phil Duran. I'm the Director of Advocacy and Research at JustUs Health. My pronouns are he and him, and I am delighted to welcome you to what I think is going to be a fantastic panel conversation among four incredible leaders here in Minnesota, each of whom is associated with an organization that is making incredible differences in people's lives, in the work of our state government, and so on, in different ways that affect LGBTQ health. And so it is an honor to be here with them and to share this time with you. The first question that I'd like to ask each person is just to introduce yourself with your name and pronouns, your particular role with your organization, and then just the basic, if you want to say the elevator speech of what your organization does and is about, what its mission and vision are, and then we'll turn into the more substantive questions for today's conversation. But that means that we will start today with Erin McQuaid from Gender Justice. Welcome, Erin.
Thanks, Phil. I appreciate you pulling this group together, and I'm really excited to be here with all of you. I'm Erin McQuaid. I use she, her pronouns. I am the Advocacy Director at Gender Justice. And Gender Justice, we are a 501c3 nonprofit, and we seek to advance gender equity through the law. And so advancing gender equity through the law, we kind of rely on three tactics or strategies. So one, we help inform how bills and legislation are written. A really good example of that is our work in the Paid Family Medical Leave Coalition. We helped write the really inclusive family definition, because we know for a lot of folks, family is chosen. It's not always by blood or by marriage, especially in the LGBTQ community. Through the law also sometimes means bringing clients that we have back to the legislature to say, hey, that bill that you wrote that you thought it did what you thought it doesn't do that. And if you would like it to, here's how you can fix it. And we use stories to do that. So for example, WESA, the Women's Economic Security Act, was passed in 2014, provided a whole host of things, including protections for people who breast or chest feed for pumping at work. And I think in the law, it says something about like a reasonable amount of time, but I don't think they clarified on what is reasonable and to whom. And so we are now seeking that clarification. And then the third way, and this is really a big chunk of our work, is we sue people. We sue a lot of different kinds of people, and we do impact litigation. So we don't do direct service work. We always want to win for our clients, but when we win, we want to make sure that the law is interpreted in a different way that provides protections to a whole host of people. And a good example there is the Affordable Care Act, in addition to providing health insurance and coverage for a lot of people, was also the newest federal civil rights law. And Section 1557 in the Affordable Care Act provides protections on the from discrimination, and it pulls in from the Civil Rights Act, Title VII, Title IX, age discrimination, race, religion, country of origin, and it also includes sex discrimination or protections from sex discrimination. And Gender Justice was the first organization that brought a case before the court to say protection from sex discrimination includes protections for trans patients, and we won that. So that is what we do at Gender Justice, and we're really excited to do that work in community. The law alone is not enough, and so we do it in community with folks on this call included.
Fantastic, thanks so much. Jeremy.
Good day, everybody. So glad to be here with all of you. My name is Jeremy Hansen Willis. I use he, him pronouns, and I'm the CEO of JustUs Health. Our direct care services, as still the state's oldest and largest HIV service provider, is applying the legacy we've learned fighting HIV for almost 4 decades to make sure that folks affected by HIV have the best quality care that they possibly can. So we provide coordinated medical care, we provide housing for hundreds of Minnesotans who have barriers to housing. We provide basic information and education to people about HIV, and really offer the most comprehensive set of services for people who are living with HIV. We also run a mental health clinic as part of our behavioral health center. So we provide mental, chemical, and peer support mental health programs to people in Minnesota, again, centering LGBTQ communities, people of color, and other communities that are affected by HIV. We also work with healthcare systems and senior care systems to make sure that the folks who are providing care at the community clinic or the medical clinic down the street from you, or the nearest senior care center, that the staff and the systems that are providing those services are doing so with LGBTQ and HIV positive people in mind. And as Erin said, we do all of this in partnership with the organizations today and so many other community partners to ensure that health equity is truly something that is a lived experience for everyone in the state.
Great, thank you. Monica.
Hi, I'm Monica, and I'm the Executive Director of OutFront Minnesota. And OutFront, we've been around since 1987, and we have this dream about our state, that we could be a state where we'd have LGBTQ liberation, which includes, thinking about how do we get to a place where Minnesota, where people can be who they are, love who they love, and not face violence, discrimination, isolation, you name it, some of the things that we're experiencing today. And so when we think about, how do you get there? That's pretty big. We have always done a combination of different kinds of tactics and strategies, like all the groups here. And one of the ways that we do that is we picture, like, how do we actually, how are we able to build the movement for LGBTQ equity so we're changing culture, policy, and winning elections in our state? And that leads us into community organizing, doing a lot of education of Minnesotans, whether it's in their schools, in their faith communities, in their communities, community centers, you name it. I mean, we picture, like, how do we make sure that we have this state that is full of humans who are working to make more love and justice happen in the world, and that they're working with OutFront or one of the organizations here or others, and that we all network together so that we can really picture how do we build the network and the infrastructure we need to make change happen. And then just one other aspect of our work that we do is there definitely are people who are still facing violence, who have barriers to all kinds of services. And so we make sure that we're there to provide support, whether it's short-term therapy, or be able to provide resources for people who are facing either intimate partner violence, domestic violence, or hate crimes. And all that's rolled together, we really, we just hope to continue to be able to build with partners like you all, just to think about what we could be doing in the rest of this year and 2021 and beyond.
Thank you. And last but definitely not least, Leah.
Hi, everyone. Thanks for having me. My name is Leah Montgomery. I use she, her pronouns, and I am the Director of Government Affairs and Health Finance at Planned Parenthood North Central States. And in that role, I run our legislative and policy work here in Minnesota. Many of you are probably familiar with the name Planned Parenthood and may know some of the work that we do. Our 501c3 entity, Planned Parenthood North Central States, here in Minnesota, we're a 5-state affiliate. We cover the states of Minnesota, North Dakota, South Dakota, Iowa, and Nebraska. So that keeps us busy in all those different locations. But overall, our mission is to affirm the right to reproductive and sexual health care by providing excellent healthcare, trusted education, and strong advocacy. And to do that, we provide our 501c3 entity provides a full range of essential health services, including gender-affirming hormone therapy, abortion care, a full range of birth control options, STI testing and treatment, HIV testing, PrEP, annual exams, vasectomies. We provide a lot of healthcare services to Minnesotans, and now a lot of those are now online. So with COVID-19 as a health provider, I'm sure Jeremy can relate, we've had to upgrade and change a lot of what we do, but there's been some silver linings there. And one of those has been a build out of our online health platform, so more people can reach us and make sure we're getting them the healthcare they need. We serve almost 72,000 Minnesotans every year across our 18 clinics in Minnesota, and we have been providing that healthcare here for almost 100 years. And in addition to our clinical services, we also have separate entities. We have a 501c4 that does all of our direct lobbying work and our field and organizing work. We also have some political action committees that are heavily engaged in election work. So we view it really as a full cycle of providing the services, fighting to make sure we're protecting the services that we're providing, and fighting for our patients, and then holding folks accountable in elections when we don't do that through our various organizational channels. So, and we do that in coordination and collaboration with a lot of you on this call. So we're really happy to do that, and appreciated the invitation to be here today. So thanks.
Terrific. Thanks, Leah, and thank you to everybody. So, as you can see, we have 4 amazing organizations, and each of them doing just an amazing amount of work in a lot of different ways here in Minnesota, and from Planned Parenthood's perspective beyond. Our first substantive question to the speakers is 3 parts, and I've asked each of our presenters to focus on a particular area of their work, so that we can get a little bit of a slice of different ways that public policy is pursued, and then we'll broaden it from there. But the question is, basically, what are your current initiatives or projects in this particular area, and then what opportunities do you see potentially on the horizon, and what are the challenges that you're facing now, or what challenges themselves may be on the horizon? Again, we'll start with Erin at Gender Justice. You touched on this in your introductory comments, that one of the things that Gender Justice is so well known for is its inclusion. And I think you were just in the news pretty recently with a major win at the Court of Appeals. So I'm wondering if you could talk a little bit about this question from the perspective of litigation.
Yeah, so, Gender Justice, again, we take on clients and do impact litigation, and we have had quite an impact. We have sued, we're in the process of suing 2 different school districts for discriminating against trans students. And what we always say, and I'll say it again here, is like, this is notice to every school district in Minnesota. We will keep suing you until you stop discriminating against trans students. Like, that will continue to happen. Stop doing it. And prepare, right? If you don't have trans kids in your schools right now, you will. So prepare and make it a welcome, inclusive place. School is a place to learn. And we had a win last week where so the first thing that happens when a case is filed is the other side says, judge, you should dismiss this case. That's the first thing that happens. And so some of the first procedural things that happen in any litigation is the question around, should we dismiss this case? It's called a motion to dismiss. And when that happens, the judge accepts as fact all of the things that are, that the people who filed the litigation have said and the people who are against it have said. And they say, okay, assuming this is all true, should we continue on? And not only did we, survive those motions to dismiss, but that was actually the important part, is that we were saying what happened to our client being segregated for being trans was illegal and unconstitutional. And the court was like, well, if all of these things happened, then yeah, it was illegal and unconstitutional. So the win there was that the court was really clear that, segregating trans students is both illegal and unconstitutional. And that was pretty great. We also have a case right now. So we're suing in partnership with the Lawyering Project. We have 4 plaintiffs. We're suing the state of Minnesota to remove the abortion restrictions from law. So, oftentimes Minnesota is talked about as an island of access, and that is not quite true. We have had numerous abortion restrictions pass in the last 20 or so years, just like other states, right? The folks who are working to ban abortion in places like Alabama and Georgia are the same folks who are funded to chip away at our rights here. We've had outright abortion bans introduced in the Minnesota legislature. We've had a number of increasing abortion restrictions pass in previous years, but they've been vetoed. They were vetoed by Governor Dayton. And so, we're suing to remove the abortion restrictions, but we're also doing a public education campaign because we found in our polling that 96% of Minnesotans didn't know about the laws. They couldn't even name one law. And so a lot of times I think our Minnesota exceptionalism, which I certainly have and share, is extended to our understanding of reproductive health care and access to abortion. And we shouldn't extend it there. So unrestrictmn.org is where you can go to learn more about it. OutFront is one of our community partners, and we are, that's ongoing litigation. We have a case right now in the courts that for a woman who was denied emergency contraception because of the religious beliefs of the pharmacist. And I think we really went into this thinking like, this is going to be about religious refusals and time-sensitive healthcare, but it literally turns out no one understands how pregnancy or uteruses work or uteri work. And so that has been an interesting thing that we're doing there too, just hearing people talk about pregnancy that's just wrong. And they're like supposed to be giving you medication. So that's kind of what we have going on with the courts right now. Things, challenges that we see coming. I mean, the uterus is shrouded in mystery for whatever reason, and that cannot continue. I also do see, there's this misconception that abortion is too political, that it's like a wedge issue, and it's not. 72% of Minnesotans agree that you should be able to make healthy decisions about your own body. If you ask Minnesotans, okay, a person has decided to have an abortion, now what? You get into the 90s of, up-to-date in medical care, and 75% in their community without shame, without protesters, as soon as possible. So we're not really divided, but I do think that that is a challenge with a lawsuit like this. Is it seems like it's controversial. It's not. Our Constitution says we have a right to access abortion care. Minnesotans believe you should. Our laws just don't reflect the values of either. And then I'm really concerned about the Affordable Care Act. So the United States Supreme Court is going to hear oral arguments a week after the election. And the question before the court is, is the individual mandate where you pay for not having health insurance unconstitutional? And if they say yes, the ACA will go away, including Section 1557, which provides protections from discrimination for LGBTQ people, patients in healthcare. Also, 20 million people will lose their health insurance, so that's terrifying. And I think the last, let's see, it was current initiatives, challenges, if any, and then
opportunities.
Opportunities, yeah. I think, at Gender Justice, we believe every person should be able to become a parent, not be a parent, whatever they would like to do with their bodies. And so often this is rooted in just access to abortion care, but we also want people who want to be parents to be able to be parents. And in particular for the LGBTQ community, that means funding fertility treatments and things so that we can actually have families. It means not allowing, adoption and foster agencies to discriminate against people who, for whatever reason, they don't think can be families that can have children. And so that is a case that'll go before the Supreme Court. Actually, Fulton v. Philadelphia, Catholic chair, or it's a religious organization that doesn't want to allow LGBTQ families to foster children, knowing that LGBTQ children are disproportionately homeless and need good, loving, affirming families. And so these are the things that are coming up. We would like to be able to move to a future where we're not terrified over losing the modicum of rights we've gotten, and that is the world we're working for. The last thing is we have a case with our client, JC Cooper. She's a power lifter. We have seen so much that the hate groups like Alliance Defending Freedom and all, they're using trans women and in particular in sports to kind of further this pernicious, terrible narrative about LGBTQ people and trans people in particular. And so we're hoping to secure, equal rights for JC and all trans athletes. So hopefully that was enough.
Well, what do you do in your spare time, so thank you for that. I appreciate it. Jeremy, I've asked you to focus on the work of JustUs Health in the administrative or executive branch areas. And I'm wondering what, same questions, what are some current initiatives, opportunities, and concerns?
Mm-hmm. Absolutely. Well, as I said earlier, the focus for JustUs Health is health equity. For all people in Minnesota, especially those whose health status overlaps or intersects with their identity as a racial, sexual, or gender minority. And we all know well the health statistics and the health disparities in our state are very pervasive in the public and private systems anywhere anybody gets care. And so there's a lot of work for us to do. In our advocacy agenda, I'll just comment briefly on that and give some examples of how we live that out administratively. For us, because of the pervasive impact that racism has on health equity, our entire agenda really is to further health justice or to further racial justice and racial equity within the healthcare space. And so our entire agenda really is focused on that goal. And within that goal of racial justice and equity in health and healthcare, our agenda really breaks down into three categories based on the legacy and experience that we bring to the conversation. First, obviously, is to end HIV. If there is ever an example of health injustice, is the HIV epidemic and how that's manifested itself in Minnesota and around the country and around the world. So our goal as the oldest, largest HIV/AIDS service organization is still to end HIV in Minnesota. And the second area of our work in advocacy is to remove and reduce and remove the barriers to healthcare access and outcomes for LGBTQ populations. And thirdly is to support both HIV positive and LGBTQ people as they age. And we do that advocacy work in a lot of different realms. And the area that I wanted to talk about is not always as exciting or grabbing the headlines as legislative victories or legal victories, but is administrative work. And a couple examples of that is one, which I think all of our folks here today are well aware of, the barriers that transgender Minnesotans have to getting the healthcare that they need, especially minors who just have so many barriers to getting the healthcare that they need, whether it's access to hormone therapy or surgery. And too often has been the case that the State Department of Human Services, either through its own policies or even when we work to change the policies, through the application of policies, does the wrong thing and decides that trans folks, especially minors, really do not have the right to get the care that they need. So we've had to sue and take legal action many times against the Department of Human Services. We've also had to sit on administrative committees and negotiations with them to ensure that their interpretation of their own policies work to ensure that all LGBTQ folks and all Minnesotans have access to the care that they deserve. So that's one example. And another example is one that we've been working on recently with the Drug Formulary Committee, which is this, in my opinion, a very non-transparent, little-known committee that decides who on medical assistance and public support systems and how they get access to medicine and whether they can get direct access to the medicine that they need or they need to go through prior authorization or other kinds of policy barriers to get the medication that they need. And recently that committee, sort of out of the blue, after decades of fighting HIV, decided to put an entire class of HIV medications on a non-preferred access list, which meant that if you wanted to get access to HIV medication because you were newly diagnosed with HIV and you need access to medicine right away, and some of the best therapies are that, are ones that you can get on literally rapid response therapies, now required a prior authorization and barriers that you might have to wait days or weeks to get access to that medication. Also, if those of you who know of Descovy or PrEP, preventative HIV therapy for those folks who want to take a medicine to protect themselves from acquiring HIV, was also put on this list so that people who are trying to protect themselves would have to get prior authorization to get access to those drugs. And so we worked to overturn that and are still working to overturn that decision so that that entire class of HIV medications is taken off of that non-preferred drug list. So those are the sort of things that we have to work on every day and every week at an administrative level to ensure that state agencies, just through their interpretation and application of state and federal law, are doing the right thing and are advancing health equity for the populations that we care about. I think in my mind, the greatest challenge we face and the opportunity has gone hand in hand this year with the commingling of the COVID pandemic and the racism pandemic that we all have experienced at levels we haven't seen in a long time. And obviously, as I said earlier, for us, the biggest barrier to equitable healthcare in Minnesota is racism and systemic racism that exhibits itself in clinics and hospitals and senior care settings across the country. And even as we work on and center HIV positive and LGBTQ populations, really what's at the core of most of that discrimination has to do with race. And so really the biggest challenge for us is this multi-century challenge we've all been fighting, which is how do we really break through the racism in our systems and society to ensure people get the health care that they need.
Great, thank you. Monica, OutFront Minnesota is certainly not the only organization on today's panel that works at the state legislature, but it certainly seems to be so much at the core of what OutFront is about. So I wonder if you can address this question from that perspective first.
Sure. And, you know, and I think about, when I think about the 2021 legislative session, what I'm hoping, Jeremy, that, you know, that there's lots of legislation coming forward about reparations and about what racial equity looks like in all of our laws. And really just, yeah, I'm hoping there's not just like one omnibus, like racial equity bill, but that it's actually a part of all of the different kinds of ways that we're going to have to look at the different economic injustices we have in our state that are also tied to racism. But anyway, so we work at the Capitol. We have been working for the past couple of years to pass a ban on conversion therapy. So conversion therapy, I'm pretty sure everyone knows about it, but I'll just say it. It's this faulty, harmful thought that some therapists have that you can un-LGBTQ someone, that you can take that out of them and then life would be good for that person. And so, so we have been working to ban it in Minnesota. Other organizations have for quite a few years. We were not able to pass it in the last legislative session, partially because of COVID and most things shutting down, but even the legislative session before that, we weren't either. Just like many good policies, we were blocked in the Senate, and we're not able to really get to get the Senate to really take up this issue. And what I think has been really good about working on conversion therapy is, of course, we want to ban it. We want the legislature to ban it. We want a strong policy that would prevent licensed medical health providers from being able to provide their faulty, harmful therapy to LGBTQ youth and vulnerable adults. We want to stop that. But what's been good about it, even though we haven't been able to pass a statewide measure, is a couple different pieces of the work. One is that they have, I think just by talking about it, I think Minnesotans know that it actually is a problem. So when we first started working on this issue, a lot of people would say, like, this isn't happening, and particularly here, and maybe it's the exceptionalism or whatever you think it is, but people were really sort of like, I don't think this is happening. And we were able to find providers all over the state who actually are still doing conversion therapy and are also like promoting it and then defending it. And then we've also had a lot of young people come forward who have been through conversion therapy and have really had to deal with the harm that it's done in their lives. So that is one thing on a state level we want to see. The second, I said there were a couple of good pieces of this. Minnesotans are aware of it now. I think people really want to see it banned. And hopefully in 2021 we can do that. The second thing is that local governments really have picked up and are moving forward with banning conversion therapy on the local level. So we've had 8 different cities pass either bans or resolutions against conversion therapy. And those have been all over the state too. So I think often, in the history of LGBTQ policies and moving forward, we've often started at the local level and then eventually we're able to pass it on a statewide level. So that happened with, in the early days, domestic partnership benefits and having domestic partner registries when our families had 0 legal protections, and then finally we're able to get marriage. But I do think that we'll get there soon. And I think we'll join the other states, and I have a cute button. Someday we'll be back at the Capitol. I don't know if you can really see it. We'll be able to be back there, their buttons on. And then I just would say a couple other pieces. We work, OutFront works with youth all over the state. We have a GSA network, Gender and Sexuality Alliance network, and we're in about 212 schools. But the youth want to ban conversion therapy, and they also want comprehensive sex ed with consent. And that's something we could all work on, all of us here, and other groups can join us. And really, let's do it, right? And throughout the years, there's a bunch of our groups that have worked in coalition together, and we need to do it. They want it. So let's pass that. And then, of course, I think looking at whatever happens with the Affordable Care Act, I just think in Minnesota, we have an opportunity to look at how we actually take steps forward to have single payer, to make Minnesota care available for all people. And so anyway, let's keep looking at how we can expand our healthcare here.
Terrific, thank you. And then Leah, how about you? From Planned Parenthood's perspective, you really highlighted how you work regionally, but then of course Planned Parenthood has a national presence, and you provide probably the most comprehensive set of direct healthcare services to people. So how would you respond to this question?
Yeah, so thanks, Phil. So I think, from a federal level, as you mentioned, we have a pretty substantive presence there. So we have a national arm, Planned Parenthood Federation of America and Planned Parenthood Action Fund, who leads all of that work at the national level. However, the states and the affiliates across the nation are also really involved in supporting that work and amplifying the work that they're doing. And obviously, I probably don't need to say that this administration, the current administration, has given us no shortage of work to do at the federal level. So, for example, right now, we, Planned Parenthood, and I'm sure others of you on the call, are really concerned about the swiftness of the confirmation process for a new justice to the Supreme Court. So we've been working hard, as has our in coalition with our national office and a lot of other groups, on making sure that we're talking to Minnesotans about what's at stake if and when a new Supreme Court justice is named, and if and when that happens before the election or before the inauguration, and what's at stake. And a lot of you have already hit on some of those things are at stake. It's the ACA, like Erin said, being heard a week after the election. It is Roe v. Wade is going to be it's going to be up in front of the court. There's 17 cases right now that are one step away that have abortion restrictions that are one step away from the court. And we know they don't have to overturn it to render it essentially meaningless. And so there's a lot of concern there. Of course, just this week, we saw that a couple of Supreme Court justices cast doubt on marriage equality. And so there's so much at stake on the courts. And so that's something that we are definitely engaged in at Planned Parenthood, both at the federal level and here in the state with supporting that work. Some other examples of ways that we've been involved is a couple of years ago, I know you'll all remember the ACA repeal fight. Our national office and us here in Minnesota were very involved in that fight as well. We were mobilizing our volunteers. We were talking to Minnesotans about what that meant, because of course, not only is the repeal of the ACA itself so scary, and it would eliminate so many health protections, it would take away health insurance from millions of Americans. But in addition to all of that, all of those repeal bills also had provisions that would defund Planned Parenthood and any other abortion provider from the Medicaid program. So it was a double whammy. And so we were very engaged on that issue because obviously that affects our patients. The majority of our patients that we see are low income and rely on Medicaid for their care. And so it would have been catastrophic had the ACA repeal along with the defunding provision at the federal level went into law. And so we were really engaged on that issue, as were many, many other organizations. And obviously we're very happy to see that not come to fruition a couple of years ago. And then of course, the Trump administration has also issued a number of rules through their rulemaking powers, primarily at the Department of Health and Human Services at the federal level, that are also really problematic, and many of which are being challenged in courts. We've engaged on those. One example is a rule that allows your boss or your university to withhold birth control coverage from you if they don't think you should have it, or if they disagree with the premise of you having birth control. So we firmly believe, as I know others do here, that your healthcare should be between you and your physician, not with politicians involved, and certainly not with your boss. And so that is incredibly concerning. So we've been fighting on that. There's been rules around allowing health providers to discriminate on people based on their sexual orientation, whether or not they have had an abortion or are currently undergoing an abortion. And we just don't think discrimination has any place in healthcare, period. And so those are just two examples of a number of rules. I could go on and on about the rules out of HHS, out of the Trump administration, that have just been incredibly problematic for all sorts of communities, particularly communities of color, LGBTQ communities, people seeking reproductive health care. And those are also the things that are harder for the public to track. They're harder for the public to understand. They're harder for us as professionals even to track and understand and move through the process and know what's coming. And so on a number of levels, Planned Parenthood has engaged in that sort of federal advocacy work, both from a congressional perspective, the court perspective, and through federal agencies and their rulemaking powers. So I think the question next, Phil, that you posed were some opportunities and challenges. And I would say one of the opportunities along this federal advocacy route is just continuing to lift up the impact that federal action, whether it's congressional or through executive action, has on the health and well-being of Minnesotans, and that those actions do matter, and they matter a lot. And it's sometimes hard to explain how that works, but I know we and others on this call have been working to talk about that. And so I feel like there's opportunity there. People are understanding the problem. They're understanding that something needs to be done. And there's work that we here in Minnesota can do through our state lawmakers to protect access to a lot of that care. So there's an opportunity there, I think, as well. And I would also say from an opportunity perspective that COVID-19 has, obviously, it's an enormous challenge. There's also been some silver lining opportunities there, particularly when it comes to how we engage the public and Minnesotans and our volunteers on the issues. In a lot of ways, it's been, it's opened the door to people across Minnesota being able to take more action in a time on their timetable. And then as far as challenges go, one of the challenges that we're seeing, and this is in the context of the Supreme Court fight, is I think, how do we keep people engaged in the work at a time when everyone is dealing with so much heaviness? You know, Jeremy mentioned, you know, we have this collision of reckoning with racial discrimination and systemic racism, plus a pandemic, plus, you know, we're just adding on to all of this. People are tired. And so how do we continue to engage people, meet them where they are, recognize the fatigue, but also make sure that they're continuing to understand what's at stake in general? So I think that's going to be certainly a challenge, as well as the fact that we'll have an entirely new legislature, as Monica mentioned, coming up. We don't know, you know, what that looks like, remains to be seen. But what we do know is that the state has an almost $5 billion budget deficit that is going to put a lot of things at risk. And we sure hope that that's not Medicaid coverage. We hope it's not other healthcare coverage, other protections, but that's a lot, that's a big deficit. And so that's going to present a significant challenge moving forward in 2021.
I think that's absolutely right. So thank you to all of the panelists. Because time is a little bit limited, I'm going to skip ahead to the last question. Recognizing that this does not offer the opportunity to highlight other things that your organizations are doing other than what you've already talked about. But the final question is, you know, how can a person who's watching this from home learn more about the broad range of work that each of your organizations is doing, and how can they get involved in supporting you or in engaging directly in that work. And why don't we go in reverse order this time, and we'll start with Leah and work our way back around.
Thanks. We have at Planned Parenthood, we have lots of ways to get involved depending on how much time and effort you'd like to put in. A really easy thing to do is you can follow us online. We're on all the social media platforms, both our C3, which is our Planned Parenthood North Central States, and our C4 and PACS, which is the Planned Parenthood Minnesota Advocate. Feel free to like us or follow us on either of those channels, and we'll keep you up to date on what we're doing. We also have, if you want to get more involved, we have lots of opportunities for volunteering, everything from being an escort at one of our clinics to make sure that patients coming for abortion care can get through that line of protesters that's there every day, 365 days a year, rain, snow, sun, wind. So you can certainly do that if you're interested in the healthcare side. We also obviously have a presence at the state capitol and do a lot of turnout and rallies and talking to legislators. So reach out to us online. You can Google us at Planned Parenthood Minnesota Advocate, and we can hook you up with a range of ways to be involved depending on what you'd like.
Fantastic, thanks. Monica.
Sure. So for OutFront, outfront.org, there's plenty of opportunities to volunteer. We also do lots of things at the capitals. We also do protests, you name it. Our latest protest was protesting against a church who was providing training for conversion therapy and how to promote it and do it. But lots of opportunities to volunteer, get engaged. Outfront.org, we're on all the socials. And then I'll just say, right now, we're currently, most of our work, just like everyone else, is virtual. And we've been able to engage people, volunteers, in a number of ways, and doing a lot of text banks, many text banks, but as well as town halls and other ways we're working to engage people. So thanks so much.
Fantastic, thanks. Jeremy.
Yes, well, I think anybody who's attending this conference and watching this panel right now should just add all 4 of these organizations to your social media. If you care about LGBTQ and HIV health issues, just do it now. Planned Parenthood, OutFront, Gender Justice, and JustUs Health should be in your social media feeds, Facebook, Twitter, Instagram, and whatever else is created over the next year. We're all there, and together we keep you up to date with what's happening and how to stay engaged. I'm guessing probably 10 to 20% of our social media is boosting the social media of our partners that are with us today. So to sign up for our social media, and that's the first thing you can do. Is pretty easy to stay informed. The second one that's, I think, helpful for us is for people to contact us to share your stories. Anybody who has experienced any kind of negative healthcare situation as a result of your identity as a racial, sexual, or gender minority should call us. We have multiple teams of experts, of people who know how to navigate MNsure, navigate private healthcare systems, can help answer your questions about how to navigate healthcare, health insurance. If you have a negative experience at a clinic or a senior care facility, we can't solve problems that we don't know about. And so we really need people to step forward and to share your stories with us, so that we can help advocate with you and for you in those settings with those healthcare systems, and also collect the stories for the broader administrative and public policy action that we're all working towards. And so stepping forward, contacting us, justushealth.org, and we'll connect you to one of our experts based on what your question or need is. And the third thing I'll note also is, if you're a healthcare provider, if you're a healthcare professional, we especially want you to reach out and to connect with us. One of our offerings is an online directory of LGBTQ and HIV positive healthcare services and resources. So if you are a provider and you want other people to know about you, connect with us and we'll get you in the directory. But that's also an opportunity to allow you to network with other LGBTQ and HIV positive healthcare providers around the state so that you can have peer support among each other. Because the other reason that that's so important is because when we're advocating in city halls or the state legislature or beyond, having healthcare providers who can speak authentically and professionally carries so much weight. And in my career of lobbying and advocating on public health issues, anytime you can walk in with a nurse or a doctor or a healthcare provider, the respect that healthcare professionals have in the public arena is really powerful. And so step forward to get connected, to network with other professionals, but you especially have a very powerful voice, and we'd love to help you to amplify that.
Terrific. Thank you. And then Erin, final word.
Yay. No. So I'll give folks two. So we're genderjustice.us. So that's our website. Sign up for our email list. I always say that part of my job as the advocacy director is to explain like the legal stuff to regular people. I literally, anyone who's not a lawyer is who I consider to be like a regular person. No offense to lawyers, love them, work with them. So sign up for our email list, and we send out explainers on things, and we do like SCOTUS chats, they're called, myself and the legal director on Facebook, so you can join those. If you are a person who wants to engage in some like virtual, talking to your legislators, we'll also provide tools for that as we get into legislative session. We do a lobby day, but I don't know if we're going to do a lobby day this year because I don't know if we're going to be able to go to the Capitol. And then the second part is to sign up for Unrestrict's web email address and all that kind of stuff too, because unrestrictmn.org, because LGBTQ rights and abortion rights are just so intertwined, right? The same people who want to tell us whether and when we're parents and if we have to give birth or not are the same people who want to control our lives and our bodies and tell us where we can be and what we can do and who we can love. So it's the same people. And with Unrestrict, we do virtual events where we'll come in and we'll talk to you about the laws. We'll talk about the Constitution. We'll talk about abortion. And we actually do a messaging training because so much of the narrative and the messaging that we use, even if we're pro-reproductive freedom, is rooted in the anti-abortion rhetoric. And so we're going to break that and give you some better words to use and phrases and practice. If you are a person of color who is interested in talking more about reproductive justice, which is a movement that was started by Black women in the 90s, OutFront Minnesota is a coalition of like 26 organizations. And within the leadership team are 2 Black women, myself and Shayla, and we talk to communities of color in particular about RJ and how we're trying to advance RJ here, reproductive justice here in the state of Minnesota. And reproductive justice is just more than abortion rights, right? Because we don't live single issue lives because we are whole, complex, wonderful people. We do hold rallies and vigils. And so we had a vigil for RBG after she passed. We were going to have a rally last Sunday, but the super spreaders being in Minnesota made it just a little dicey. So we'll be doing a virtual event, but we can help folks, write letters to the editor or figure out the best ways to talk about things. I see so often, and I don't know if this is the group, but if you have friends and loved ones, people struggle to talk about trans people. They struggle to talk about abortion care. They struggle to talk about gender equity issues. Like, we're folks that can help with that. And in particular, if there are any cis folks watching, letters to the editor to talk about trans inclusion is always, always needed. This is especially, I'm going to talk to like my lesbian sisters out there. This is a way, like, the trans exclusionary radical feminists trying to carve off trans women from our movement is deeply, deeply disturbing, and we cannot let it happen. And so if, every time you see it, like, speak up, write your letters to the editor, do it in your local paper, and we can also help you with that. So sign up. There's lots of ways to get involved. And last thing, donate. Gender Justice turned 10 this year. We were going to have a really big, beautiful gala. We didn't. And so we were going to raise a lot of money off of that. We could always use donations. And same with Unrestrict. We are like a fledgling, 25 member coalition just trying to like expand abortion access in Minnesota. But we are small, we're mighty, but we need your money too. So donate to us. Even $5 helps.
Excellent. Thank you so much. So that is the time that we have for this panel today. I want to thank everybody who's been a part of this. So Leah from Planned Parenthood, Monica from OutFront Minnesota, Jeremy from JustUs Health, and Erin from Gender Justice. Thank you all for taking the time to be a part of this conversation. It's an honor to see you, if not be in the same room with you, and to work together on our shared agenda for a better, healthier Minnesota. So for all of you who are watching at the Opportunity Conference, thank you, and we hope this has been a useful program for you, and we look forward to seeing you in other sessions. So thanks.